let me go through few question and answer. And this question and answer is highly important for our NCLEX board. The NCLEX question, just like this group of questions, most of the questions we collected from previous year, and when students practice them, they will be benefited, and also the student after them pass their licensing board, they do not forget to give us a thank you for these questions. First question here, let me read it what they wrote. The client has an order for gentamicin to be administered. Which lab results should be reported to the doctor before beginning the medication? Number A, hematocrit. B, creatinine. C, white blood cell count. And D, erythrocyte count, right? Means red blood cell. So gentamicin is an antibiotics. Gentamicin is an aminoglycoside antibiotics. These drugs are toxic to auditory system or auditory nerve, and this medication is toxic to your kidney. This is the reason we have to check the creatinine level. And this is the answer. Let me recap it. I said gentamicin is an aminoglycoside antibiotics, and keep it in mind, gentamicin are the toxic to the kidney and toxic to auditory nerve. So we need to check the kidney function. How we do this? To check the creatinine level. So number A, hematocrit is not a significant consideration in this client. Therefore, answer A is incorrect. Answer C, white blood cell count, is important if patient have any kind of bacterial infection. So answer C is incorrect because we would expect the white blood cell count to be elevated in this client because gentamicin is an antibiotics. Answer D is incorrect because the erythrocyte count or red blood cell count is also particularly significant to check. Next question here. Which of the following is the best indicator? Diagnosis of SIB. Number A, white blood cell count. ELISA, ELISA test. C, Western blot, and complete blood count. So what is the correct answer? So indicator for the diagnosis. The most definitive diagnostic test for SIB is the Western blot. Let me recap it, and you should keep it in mind. The indicator for diagnostic of SIB, the test is called Western blot. The white blood cell count, number A, is started in answer A, is not the best indicator, but white blood cell count is less than 3,500 is required to investigation, but not the best indicator. ELISA test, I mean answer B, is it is the test, or it is the screening test, right? And answer D, complete blood count test, is not a specific enough for HIV diagnosis. Next, the client present to the emergency room with a bulla eye or bullish eye rash. It is a very characteristic skin rash. Which questions would be most appropriate for the nurse to ask the client if you have a bullous eye rash? Number A, have you found any tricks on your body? Number B, have you had any nausea in last 24 hours? Number C, have you been outside the country in the last 6 months? Number D, have you had any fever for past few days? The correct answer is number A, right? Number A is a correct answer. Why? Because bullous or bullish eye rash is indicate of Lyme disease. Lyme disease is a disease spreaded by ticks. The sign and symptom include elevated temperature, patient complain headache, nausea, and the rash. And rash supposed to be look like the bullous eye. The sign and symptom include, again, I'm repeating, temperature, headache, nausea, and characteristic skin rash. Although the answer B and D are important, the question asks which questions would be the best. Answer C has no significance because country last 6 months, it does not make sense. Have you had any nausea last 24 hours? It is important question, but it is not the most appropriate. It is not the most appropriate. Number D, have you had any fever? It is important, increased body temperature, but not most significant. More significant, have you found any tricks? Next, which client should be assigned to the nursing assistant? So you have to know what are the functional role for CNA or UAP or nursing assistant. A 18 years old with a fracture to two cervical vertebrae. B, infant with meningitis. C, elderly client with a thyroidectomy 4 days ago. And D, the client with a thoracotomy 2 days ago. Right? So the correct answer is here, the number C. So elderly client with the thyroidectomy 4 days ago means this patient is stable already 4 days after the surgical operation, right? So 18 years old with a fracture, it is very unstable patient. You can't assign nursing assistant for them. The infant with meningitis, no, right? The client with a thoracotomy 2 days ago, it is little bit stable, but this is the most stable patient. So client that need least skill nursing care is the client with a thyroidectomy 4 days ago. Answer A, B, and D is incorrect because the other client are less stable and require a registered nurse. Next, the client present to the emergency room with a hyphema. Which action by the nurse would be the best? Number A, elevate the head of the bed and apply the eyes to the eye. B, place the client in a supine position and apply heat to the knee. Insert a Foley catheter and measure the intake and output. And number D, perform a vaginal exam and check for the discharge. Before to answer, I want to tell you what is hyphema. So hyphema is the presence of blood in the space between the cornea and iris in the eye. So a hyphema is when the blood collects inside the front of the eye. And this happens between the cornea and iris. The blood may cover the part of all of the iris and pupil. Right? So first of all, let me tell you what is the correct answer. The correct answer is elevated the head of the bed and apply the eyes to the eye. So hyphema is, as I told you, hyphema is blood in the anterior chamber of the eye and around the eye. The client should have had of the bed elevated and also need ice applied. Answer B, C, and D are incorrect and do not treat this problem. Next, the client has an order for ferrous sulfate liquid, means iron preparation. Which method of administration would be the best? Number A, administer medication with milk, admin medication with food, and admin the medication with orange juice, and D, administer medication undiluted. What are the correct answer? The correct answer is C, right? Administer medication with the orange juice. So ferrous sulfate or iron should be given with ascorbic acid. Ascorbic acid means vitamin C, and we get vitamin C in orange juice. Because ascorbic acid or vitamin C or orange juice, this help with absorption of iron. And it should not be given with milk or milk, because this decreases the absorption. So answer A or B is incorrect, because milk or food reduce the absorption. And given it undiluted, number D is not a good because it tastes very bad. So 79, next question here, the client with a ileostomy is being discharged. Which teaching should include in the plan of care? The patient who have ileostomy means surgically remove of ileum, anatomy. Using care powder to seal the bag, getting the ileostomy daily. Number C, using the stoma intensive as the best clean protector. Number D, using neosporin ointment to protect the skin. Answer, correct answer is number C, using the best skin protector, right? So the best protector for the client with ileostomy to use is a stoma adhesive, right? So answer A is not correct because the bag will not seal if the client use the powder. And answer B is incorrect because there is no need to irrigate ileostomy, no need to wash. And answer D is incorrect, is not used to protect the skin because it is an antibiotics, neomycin. Next here, vitamin D is administered to the newborn shortly after birth. For which of the following reason? So vitamin K, admin just after birth, newborn shortly after birth. What are the reason? This is the question examiner asking us. To stop the hemorrhage, to treat the infection, to replace electrolyte, and number D, facilitate the clotting. The correct answer is number D, to facilitate the clotting. This is the answer. Vitamin K is given after delivery because the newborn's intestinal tract is sterile and lack of vitamin D needed for the blood clot. So answer A is incorrect because vitamin K is not directly given to stop the hemorrhage. Answer B and answer D is incorrect because vitamin K does not prevent infection or replace the electrolyte. It is vitamin K facilitated the clotting. Next here, before administer methotrexate orally to the client with the cancer. This is the medication we use for cancer therapy. The nurse should check for what? What we need to check? IV site, electrolyte, blood gases, and vital sign. The correct answer need to check the vital sign. Why it is the answer? The vital sign should be taken before any chemotherapy, right? This is a cancer medication. It's called methotrexate or methotrexate. So if it is an IV infusion of chemotherapy, the nurse should check the IV site as well. But first priority to check the vital sign, then you can see the IV site. Answer B or answer C are incorrect because it is not necessary to check the electrolyte or blood gases. What next? The nurse is teaching a group of new graduates after the safety need of the client receiving chemotherapy. Before admin chemotherapy, the nurse should do what? What should do? Before chemotherapy, admin a bolus IV fluid, admin pain medication, administer an anti-emetics, and D, allow the patient a chance to eat. The correct answer here is number C, means admin and emetics, means the medication what can stop the nausea. Nausea means desire of vomiting. So before chemotherapy, an anti-emetics should be given because the most chemotherapy agents can cause nausea. Nausea stands for desire of vomiting. It is not necessary to give a bolus IV fluid or medication for pain or allow the client to eat. Therefore, answer A, B, or D are incorrect. What next? The client is admitted the postpartum unit, means after delivery of the baby and placenta, postpartum period, recovery phases, with order of continue infusion of Pitocin. Continue infusion of Pitocin. The nurse is aware that Pitocin is working if the fundus is A, deviated to the left, B, found in the midline, C, when uterus is boggy, D, 2 finger below the umbilicus. The correct answer is when uterus is firm and in the midline. That times it can work. The Pitocin can work. Pitocin is used to cause the uterus to contraction of the muscle and decrease the bleeding. So the uterus basically deviated to the left as started. So deviated to the left, answer A, indicate the full bladder. It is not desirable to have a boggy uterus. So answer C is not answer. This lack of muscle tone will increase the bleeding. Answer D is incorrect because Pitocin does not affect the position of uterus. Next, yeah. A 5-year-old child is old is a family contact to the client with a tuberculosis, so pediatrics patient. Isoniazid is a medication we use for tuberculosis. Has been prescribed for the client. The nurse is aware that the length of time that the medication will be taken. So what are the medication name? Isoniazid. So how long medication supposed to use? Number 1, 6 months, B, 3 months, C, 1 year, and D, 2 years. The correct answer is 6 months, right? The household contact should take isoniazid approximately 6 months. Let me read it. I said household contact should take the isoniazid approximately 6 months for prophylaxis. Answer B, C, or D are incorrect because they indicate either too short or too long of a time to take the medication. The next here, a 4-year-old with a cystic fibrosis, the disease called cystic fibrosis, has a prescription for Biochris pancreatic enzyme to prevent malabsorption. The correct time to give a pancreatic enzyme is A, 1 hour before meal, B, 2 hour after meal, C, with each meal and snack, and D, one empty stomach. So cystic fibrosis is a genetic disorder in which the lungs get involved, in which the digestive system get involved, right? Basically, the lungs or digestive system get full of mucus. Cystic fibrosis patient present with so many complications like persistent cough or post-nasal drip, wheezing, shortness of breath, sinusitis, inability to exercise. In case if men develop infertility, repeated lung infections common, foul smelling, multi-gracious stool, poor growth, or low body weight, although has a good appetite, very common. If patient have cystic fibrosis, we recommend one or more of this diagnostic test or procedure, right, as a part of evaluation. Like diagnosis is based on information. The correct answer from here is number C, means 2 hours after food. No, I said C means with each meal and snack. This is the correct answer, right? Because this medication, pancreatic enzyme, that is used to facilitate the digestion. So we eat, before eat or with the meal, we should give it. And it should be given with meals and snack. And it works well with food, such as with other kind of food. Answer A, B, and D are not correct.